Well, Cheryl, your examination today is excellent, as it has been for some time. There's really no evidence of active arthritis whatsoever. And how are you feeling?
I actually feel pretty darn good. In fact, so much so I sometimes don't want to come in here. It's great. I feel good.
Well, I brought you in a little early, really, to discuss a letter I've received, and I know you've had a copy from your insurer, about the planned transition from the biologic molecule that you're receiving along with methotrexate to what's been called a biosimilar. Now, it sounds like a big change, but the biosimilars have been studied in thousands of patients. They're as safe and as effective as the drug you're on. And the switch is going to save the insurers and government thousands of dollars, which they're going to put back into medications for people with arthritis. So it's a policy transition. We're not concerned about it, but I wanted to bring you in so that we can answer questions. I see you have your usual slip of paper with some questions.
So you knew I'd come armed with questions. I appreciate you being willing to answer them for me. I am concerned, and I'm concerned, I guess, first off, about how new they are. You know, sometimes new is good, sometimes new isn't good. So how new are they?
So these biosimilars have been used since about 2009, and in Canada since 2014. So they're not new. There are thousands of people who've had them. There's more than 75 studies that have been done looking at how similar they are, and they're very similar.
So tell me then, you've explained to me that they're as safe and effective. Why are they less expensive? Like, why all of a sudden am I being asked to change or move my prescription because of cost savings? How can that happen?
If you originate any drug, you have a patent. You're protected, and only you can sell it for a period of years. When the patent expires, one can make copies for small molecules like naproxen or methotrexate. They're called generics. For the big biologic molecules, they're called biosimilars. You don't have to originate the drug. You don't have to come up with completely new manufacturing processes. Results in considerable cost savings because of the costs you don't have. And insurers are going to benefit, governments are going to benefit, and patients will benefit.
Okay, that makes sense to me. So my next question is, what's your experience been prescribing these to other patients like me? You can imagine having done well, and I've been doing well, and I'm still doing well. I kind of want to know what's happening when you're prescribing these things.
Firstly, let's go back to when you were starting your originator biologic. You were pretty nervous about that. And we got over that, and you've been hugely well controlled as a result. What I can say about the biosimilar is they've had extensive study, both clinically and in the lab, to show that they are as safe and they are as effective as the originator molecule. I really feel convinced of that, and don't expect there to be any real surprises for you. Okay. Firstly, thousands of people have already been transitioned to a biosimilar. In my practice, anyone starting on the same biologic as you recently has started with the biosimilar. It was regulated by the insurers and the government that we should start new people on the less expensive version. They are now saying we should transition people, and I have been doing that already in some patients who are fine with it. I've discussed it with them, and it's intriguing that people say, yes, I'd like to save some money, and yes, I think if the money's going back to arthritis care, it makes a lot of sense.
Okay. So is this going to change how I get my medication? Like I normally, get my renewal from the nurse, and then I, go down the street and I give it to my pharmacist, or you fax it there. Is that process going to be the same?
There will be a new patient support program. You've had a good patient support program, and I think the one that will be available to you will be just as good. And they're there to help with any problems that you have, as will be my office.
So, Dr. Esdale, am I likely to experience side effects after I actually, take my first dose or a couple of doses?
There's really no reason to believe that you're going to have new side effects, as this is so similar to the drug you're currently receiving. I really don't foresee you developing anything in the way of a new side effect. As you remember, when we discussed the drug 3 years ago, many of the side effects we worry about are going to occur early. And so I don't see any reason for you to be concerned about developing a new side effect. If there is any issue, of course,
Call.
we'll sort it out.
Okay.
But I'm not expecting that at all.
Okay, thank you for that reassurance. So last question, where can I get more information? I'd like to go to a credible source or sources, if you can recommend a few.
I'm going to do that. I'm going to give you a pamphlet with the name Arthritis Consumer Experts and a little information and their website. They have been working with rheumatologists to develop information for patients written in a language that patients are going to understand, no medical speak.
Well, I want to thank you so much for taking the time to talk to me. I was concerned, as you know, first coming into this conversation, and I'm certainly less so now. And I know that you guys are there for me as you always have been. Thanks.
No, thank you for coming in.